Hi everyone, my name is Leanne Kirkup and I am one of the health literacy trainers for the North East and North Cumbria Integrated Care Board. Here again today with another one of our health literacy accessibility videos. And this one today is going to be focusing on talking directly to your audience. So, what do we mean by talking directly to your audience? Well, it simply means that when you're writing or when you're speaking, just to use I, we, and you. So that's known as using the first and second person. And we really do encourage you to steer away from or avoid using the third person whenever you can. Really don't use it. So just to give you some examples, basically instead of saying staff or the doctor when you're writing or when you're talking, you would say we. And instead of saying the patient or the client or the visitor, you would say you. And that's it, simply. So talking in the first and second person. Why do we do it? So why do we talk directly to the audience? Well, first of all, it makes it more personal. So when you're talking directly to the patient or, your service user, whoever it might be, it definitely does make it more personal for them. The tone is different. It's warmer, it's more friendly for them, and the information is received better, it's received well. It also helps them to put themselves in the scenario, so it's easier for them to imagine. If you think about it, if you're given some instructions or whatever, and it's saying the patient should do this, the patient should do that, you're almost reading something or listening to something and thinking that you're not seeing yourself in that scenario. But if it says you need to do that or you need to do X, Y, and Z, then it's talking directly to you, and you take that instruction as a definite for you. So it helps people to relate to that information better. When it comes to making the sentence more active or the information more active when you're talking directly to your patient, it's just easier for people to understand. Now, we do have another video on the active and passive voice. So if you do want to learn a bit more about that, I would suggest that you watch that just so that you can get a good understanding of, the active voice and the passive voice. So how can we make sentences direct so that we are talking directly to our audience? Well, we've already touched on it very, very slightly, but just to give you a few more examples, just look for sentences with words like staff, doctor, nurse, and change them to they or we. Then look for sentences that, talk about the patient or the visitor. And again, see if you can change those words to you. It's almost like you're having a conversation with someone rather than keeping it, as the third person. What do direct sentences look like? Well, just to give you an idea of kind of what you might be looking for in written text. So direct sentences, we've got one here that says staff will wear disposable aprons and gloves when caring for you while you have symptoms of diarrhea. We've simply changed that to we. So we will wear disposable aprons and gloves when caring for you whilst you have symptoms of diarrhea. It just makes it it's more of a conversation. It's more personal to that person. Then you've got a ward nurse will take your child to theatre, and instead we've changed it to we. We will take your child to theatre. That's that friendly tone. It's that first, that first person essentially. Then we've got a bit of a longer one here for you. So we have in an emergency, when someone collapses and their heart and breathing stop without warning, health professionals will try to restart the heart and breathing if there is a chance that CPR will work and the person is not known to have decided against receiving CPR. So we've changed that slightly. We've picked out health professionals and we've changed that to we. We've changed also, we've taken out the person and we've changed that to you. So it now reads, we will try to restart the heart and breathing if, and then it says you are not known to have decided against receiving CPR. So again, it's just that more conversational approach, getting rid of that third person and keeping it as the first and second person. Now, I do want to give you another top tip before we finish this little video, and it would be to write as if you are speaking to them in person. So these things you can apply to written, communication and, verbal or speaking. But if you are applying this to your written work, I would just say write as if you're speaking to that person. I think it would be safe to say or fair to say that your conversation kind of naturally changes, or the words that you use naturally change when you've got someone in front of you. So keep that in mind when you are writing things down, and it might just help you keep that friendly, warm tone, and it might help you get into the habit of using first and second person and steering away from third. And that's really it in terms of, speaking directly to your audience. So this video is part of a series which does include other tips and guidance for making your health information easy for everyone to understand. If you do have any questions, please, feel free to contact us. Our email address is on the screen there. So it's stsft.nenchealthliteracy@nhs.net. So you can contact us on that, and you will also find some further information about the health literacy information that we've got, or further training that we can deliver, and that information is available on the North East and North Cumbria Integrated Care website. So yeah, feel free to venture onto that and have a look and see if you can get some extra information and tips from there. Thank you very much.